Here we go. Okay. Dr. R, our dear sweet Dr. R, thank you so much for doing this. This is like incredible. And we're going to get this down to a science. Question number 1. Is DIM good or bad for estrogen dominant women? And this woman goes on to say, who wants to redress the balance of P, please? Do you understand that question?
Who want to redress what? No, read me the second half. I got the first part about DIM.
Okay. And she goes on to say, basically, women who want to redress the balance of progesterone, please. So,
all righty.
yeah.
I got it.
Got it.
Good morning, everybody. Audience, please let us know if everything's going okay. And the first part of that question, DIM, it's an abbreviation for diindol. I'm not going to go on with it. And, you know, I got very interested in it about 20 years ago. And the purpose that I originally learned about it was supposed to facilitate proper metabolism of the estrogens. For example, we think of estrogens as a hormone, and if a woman is on Biest, my favorite, estriol plus estradiol, often 80% estriol, or sometimes when women are on estradiol, the DIM is most related to the estrogens. And whatever estrogens a woman is taking, or even her ovaries are producing in a younger woman, ultimately that estrogen must be metabolized in the liver. It must be processed. It must be transformed from estrogen into something that isn't active, and then it's eliminated. So the body's constantly producing estrogens. The body is constantly eliminating estrogens. Or when a woman's in menopause, the woman's applying estrogens. They go through the body, they circulate, they do their good thing, and so many cells all over the body. It's outrageous how much universal influence estrogens have. Then they go to the liver. Then the liver biochemically transforms them, takes out the estrogenic effect out of them, and excretes them, gets rid of them. Thus, the cycle continues. Ovaries produce, circulate to the body, do their thing, get to the liver, get dismantled by the liver, otherwise known as metabolizing. And that's in a young woman or in a woman whose ovaries are no longer producing estrogen. I know I'm repeating myself. She's applying hormones, same process. They go all over the body. They do their good thing. They wind up in the liver. Is the one that is one of the beginning metabolizing points.
Right.
Estrone, it goes to 16 alpha hydroxyestrone. That's no longer hormonally active. That's terrific. And then the 16 alpha goes to estriol. That's got some activity. That's a very beneficial metabolite or parent hormone for estrogen. That's one possibility. Another possibility is that estrone goes to 2-hydroxyestrone. Two possibilities, there's actually three, but the two possibilities we're concerned with, 2-hydroxy or 16-alpha hydroxy, those two possibilities. And in the healthiest state, women are producing more 2-hydroxy than they are 16-alpha. That's the healthiest state. In fact, we'd like to see a woman produce, her liver produce about twice as much 2-hydroxy as she is 16-alpha. That's, if you test a lot of young women, that's nature's way of processing the estrogens. There's also some 4-hydroxy, but that's for another day. 2-hydroxy, twice as much as 16-alpha. Well, not everyone's liver is behaving. It is remarkable how many women's is behaving, how many this turns out to be true, that a woman is producing twice as much 2 as she is 16-alpha. But in menopause, even more so, and even in younger women, sometimes there's more 16 alpha being produced, a little bit too much. This is not the proper metabolism. And what DIM is purported to do is move the ratio so you get more 2-hydroxy and less 16. So in a ratio, so you should have about twice as much 2. I'm trying to get my hands right in this movie here. You should have about twice as much 2 as you have 16 alpha. But sometimes you get, this is really wild.
I know, it's weird.
Sometimes you get more 16 alpha, or you get them about equal. Well, we want to copy nature, so we want to push that 2 back up. That's what DIM is supposed to do. Now, I have been prescribing DIM for 20 years, and I do hormone testing that reveals to me those 2 metabolites, 2-hydroxy and 16-alpha-hydroxy, as well as a lot of other things. So I get to see, is there twice as much 2 as there is 16, or even more, 4 times as much 2. We want to see a lot of 2. And when I don't see it, when I see that the 2 is not as good as this is so wild.
I know.
I'm reversed. See, I'm looking in a mirror. When I see the 16 alpha has risen, this is 16 alpha, I'll give DIM, and hopefully it'll go back. So we get more processing, more like copying nature. Question, does it work? Not always.
I mean,
so
like,
I sort of lost this amazing faith in DIM, sorry to say. And there's another one that does this too, indole 3-carbinol.
right.
I sort of lost my faith, but I'll still do it. I still have patients on DIM, and I don't see this remarkable corrective ability. And this is what I believe to be happening. I do not have the same liver at my age that I had when I was 20. Neither does anybody else. Our livers have been taxed like everything else. And I'll give you an example. When I was in medical school, I would drink a cup of coffee at 10 o'clock in the evening because I had to stay up. No problem. And then I'd have to drink another cup of coffee at 11 o'clock because my liver was so powerful, it would metabolize that caffeine and get rid of it in an hour. This is just amazing. And then I have to drink another cup of coffee at midnight. No problem. I didn't even think about it at that time. I just keep drinking coffee to keep myself awake, right? Well, I wouldn't drink a cup of coffee at 6 o'clock at night or at 4 o'clock in the afternoon. I wouldn't dream of it because my liver is no longer dismantling the caffeine at the rate it did when I was in my 20s. And that's true about everybody that I've ever run into. And one of the questions on our questionnaire is, how fast could you drink a cup of coffee at 6 o'clock? And it's amazing how few women in menopause are going to drink a cup of coffee at 6 o'clock in the evening because it's going to keep them up because their livers are slower. So when I see a 2 to 16 issue, too much 16 as compared to 2, I start asking about the liver. And one of the things when I start asking about the liver, and this is moving into functional medicine, I start asking about the gut.
Right.
The gut travels to the liver via lymphatics for good reasons. And if there's problems in the gut, such as bacteria that don't belong there, and bacteria are peeing and pooping, so to speak,
Hopefully.
not in the traditional way as we think of humans doing it, but they have metabolic byproducts, and those can get sucked up into our livers, and our livers have to spit them out. And if you've got our wonderful, friendly 3.5 pounds of healthy bacteria, we're used to their pee and poop. We love it. It does us great things. No problem. However, when we got some uglies in there, things that don't belong there, an overgrowth of yeast, you got parasites, you got bacteria that are not our friends, their chemical byproducts are not acceptable. They're jamming our livers. So one of the first things I do when I think that a woman has an unbeneficial 2 to 16 ratio, sorry to make it so long, folks, but you asked the question. I'll go to work on the intestinal tract. And one of the first things you do with the intestinal tract is you see what people are eating. Because when people are eating a lot of organic vegetables and, healthy food, that tends to favor healthy bacteria in your gut. The
Well,
kind
the
that
way
are
I've learned it is that there are foods and then there are things that are like foreign invaders.
exactly. And when
You
someone's
know?
eating a lot of sugar, for
Right.
example, a whole different bacterial population and yeast population can grow because they love sugar. And
Right.
so
So when
when the first thing we're talking about the gut is we're talking about what is someone putting in their gut. So I'm sorry to go so far afield, but here's my point, and I'm going to stop this answer really quickly. When
okay.
I see improper or unhealthy or non-like nature processing of the estrogen, and I can see that on the hormone test that we do, I start thinking about how healthy is that liver. So yes, I'll go to DIM, but really I'm more interested in the health of that liver. And when I'm thinking of the health of the liver, I'm thinking about the exposures of toxics in your house. Like you got toxic chemicals, so you're giving your liver too much to do, or you're wearing perfumes, or you're around cigarette smoke. How about your cleaning fluids, all kinds of stuff,
Hairspray.
hairspray, all the stuff, because that really taxes your liver. So we want to untax the liver and we want to untax the gut. So sorry to make a long thing, but when I'm seeing unusual ratios, I think first about the health of the liver. And yes, I'll still prescribe DIM, but I'm not super impressed.
Okay, so like, could I just go right now and eat a stalk of broccoli and feel protected?
Well, like I say, it's more complex than that. It's
Well,
how
I know,
healthy
but I
is
mean,
someone's
just saying.
liver. Yeah, broccoli. I know what you're inferring there, Carolyn, that this DIM and indole 3 carbinol are derived from the brassica family, broccoli,
Right, right,
cauliflower,
right.
and those things are good for us for a lot of reasons, including the DIM and indole 3 carbinol. However,
Got it.
however, by the time you start seeing in unoptimal metabolizing, it's time to take on the project called the liver and take on the project called the gut. These are long-term projects usually. There's no urgency. Like, for example, when I'm looking at a woman's hormone test and I'm seeing an excessive amount of estrogen, when I see too much estradiol and estrone in their test, this is not acceptable to me personally in most, but not all incidents, because an excessive amount of estrogen means she's at risk for excessive
Breast
stimulation of her breast glandular cells. We
tissue.
don't want that.
Yeah,
We don't want
no.
breast glandular proliferation in
Right.
an older woman. So when I'm looking at a hormone test, number one, does she have too much estrogens? That matters. We don't want to give her increased breast density. That's a risk factor for problems. Then the next layer is looking at those metabolites. I want to see a lot of estriol. I want to see at least 2 times as much of estriol as we've
As
got the sum of
estradiol.
the potent
Yeah,
estrogens,
yeah,
estrone and estradiol.
right.
Then, and not as my highest priority, and there's controversy about in the literature about the 2:16 ratio. That's the third tier. And the main thing I get out of the 2:16 ratio is go after that liver, go after that gut. You can even do a liver detox, a liver
I
cleanse.
am doing one and I'm not enjoying it very much, I must tell
Yeah,
you.
but it works.
I
So
know.
there's been so many questions coming in
There
that,
are.
and so I want to honor these questions that are coming in around
Well,
DIM.
here's what I want to say is that hi Dama and hi everybody, and I have these questions prepared. I promise you that you guys will be able to come up and ask these questions yourself. You won't really need me. I'll be here, but Dr. R is going to be able to answer these questions. It's going to be a 3-hour long interview if I continue to answer these questions, if you don't mind. I can get back to them if I can just get to some of these.
Carolyn, let me do this. I see these questions and I'd like to
Okay.
answer them. Elizabeth is saying DIM gives her wicked headaches. Yeah, no matter what someone's idea is about anything, including nutritional supplements, it always comes down to what's going on for you personally as an individual. And there's a lot of reasons you can have an adverse effect to something. Now, wicked headaches from DIM, that's the first for me. Depends how I don't hold it to be super important that you do DIM, but there's a minor question is why are you getting wicked headaches from DIM? There could be several reasons. You get wicked headaches from broccoli or cauliflower. So I can't give you the full answer, but sometimes a clue like that, getting wicked headaches from a relatively innocent supplement, it's curious. What would be far more important for you, Elizabeth, is, don't take it, and let's evaluate your total health situation and identify your highest priorities. I doubt that you getting wicked headaches from DIM is going to be the highest numero uno on your list to improve your health. Let's keep things in perspective and don't take DIM for a while. And then maybe DIM will giving you headaches is going to be a clue to something that's awry. But right now, there would be a certain path to take and use that as a clue, including hormone testing. Because if DIM is doing something funny to your hormones, I haven't seen that happen, but I'm sorry I can't answer that in more detail other than what I've said. And here's a question from Tabitha Danes. Hope I am pronouncing your name correctly. What in the world is anovulatory bleeding and how is it stopped? Good question. Traditionally, and in the healthiest of circumstances, every young woman who menstruates is menstruating regularly and monthly. And here's what you need to menstruate. You need enough estrogen to stimulate the formation of the uterine lining. So you've got something to menstruate. And of course, when you produce a uterine lining once a month, that puts you in a position around mid-cycle that you would have a uterine lining for implantation of a fertilized ovum, if that were to take place. And if you don't have a fertilized ovum land on that endometrial lining, you'll menstruate it at the end of the month. You'll get rid of it. Now, there's two types of menstruation. One that occurs with ovulation, and that's very regular. If you're a regularly menstruating woman, it's highly probable that that's associated with a mid-cycle passing of an egg down that fallopian tube to get fertilized. But it's possible that your ovary does not pop an egg out to travel down the fallopian tube and thus be prepared to get fertilized. Ovulation is when the ovary pops that egg, and ovulation is when the ovary does not pass an egg. And thus, you don't need ovulation or you don't need ovulation to menstruate, because menstruation is about shedding the uterine lining. Here's a clue to whether you're ovulating or not. If your cycles are super regular clockwork, there's a high probability that you are passing an egg once a month. Certainly on every regular cycle, if you're every 28 days or every 27 days or every 29 days, whatever that regular clockwork thing is, it's highly probable you are ovulating. When a woman gets into irregular cycles, the very first thing I suspect is she didn't ovulate. Because part of what causes regular cycles is the regular ovulation thing. So the flip side of that is if your cycles are regular, it's highly probable that you're not ovulating. Now you can tell by doing a basal temperature test on some graph paper. And what you do is you put a thermometer by your bedside. And when you wake up in the morning, every morning you take your temperature and you put it on a graph paper. So if it's 98.6, You put a dot at 98.6. You do some nice graph paper, and you do that daily. And if your temperature remains the same the whole cycle, you probably did not ovulate. If your temperature increases around mid-cycle, you most likely ovulated. And just for fun, I'm going to tell you why that happens. Progesterone, if you ovulate, the cells in the ovary that were left behind, the cells that surrounded the egg, don't believe in the divine yet? Just study the female menstrual cycle. You will become a believer. The cells that are left behind from the egg that ovulated, that surrounded the egg, they become progesterone producing factories. And you get a massive output of progesterone. Mid-cycle. Massive amount. You get 100 times more progesterone put out than you do estrogen. Oh my God. Mid-cycle. Now, progesterone, follow the bouncing ball if you can. Boing, boing, boing. Progesterone facilitates other hormones. One of the hormones that facilitates is thyroid hormone. In other words, for thyroid hormone to work beautifully, the best it can be, it needs progesterone mid-cycle. And when you get a nice increase in thyroid hormone function from that output of progesterone mid-cycle, your metabolism increases. And what metabolism produces is carbon dioxide and, tell me group, carbon dioxide and, tell me, Carolyn.
I have a bunch of answers. I don't know. ATP.
Heat. There you go. You're deep in the weeds. You're going to school. You're learning all kinds of stuff.
I'm a colleague.
And what metabolism produces is heat. So you get a heat increase if you get progesterone, and you get that burst of progesterone if you ovulate, and you don't get that progesterone if you don't ovulate. So mid-cycle, if you're tracking your temperature, it's not going to be a huge increase, but you're going to see a couple tenths of a degree of increase. That tells you that you ovulated. And then some women get middle schmerz. They get lower right side or lower left side discomfort. And that's usually the sign of ovulating. Sometimes it doesn't actually pop the egg. You just form a little cyst. So, you can see that I can get deep in the weeds and a little thorough. And I want to go on to the second part of your question, and I realized that I didn't answer the question around DIM and progesterone, because I don't know that DIM is related to progesterone.
That's why I asked it. It's very interesting to me.
I don't know that DIM is related to progesterone at all. So sorry to say I can't tell you about that one. Now, Tabitha, on month 3, been taking 20 milligrams of medroxyprogesterone every day and still not stopped. Yeah, there's a good reason for that, because progesterone itself suppresses the endometrial lining. And so it's common for a gynecologist to want to give you a decent or robust dose of a progesterone to try and suppress that endometrial lining. It's a good idea. And I must say that my favorite is not medroxyprogesterone acetate, otherwise known as Provera. But, it's a good strategy. I prefer micronized progesterone in some really substantial dosages. And there is a reason why your doctor prescribed that. And so your doctor will probably follow other possibilities like a fibroid or something that could be causing excessive bleeding or excessive estrogen. So there's more to be worked out there. And I would need more information to be able to help you. But it sounds like you're under the care of a physician, and they're going to track down that excessive bleeding. It's 99 times out of 100. It's just something you got to figure out. And it's a good suggestion to take extra progesterone. I would prefer micronized progesterone, 100, 200 milligrams, even higher. Here's a question from Dama. Do you need to get your E2 up to 70 to 100 before you add progesterone? I'm post at 45. I'm 49 now. Well, there's a couple questions in there. And Carolyn, my God, I haven't even had a chance to say much of a hello to you this morning.
I am finding that highly offensive, but I love these women because I know them and you're taking it over, and that makes my job a lot easier. That's good. It's working.
Progesterone, oh my goodness, it's such a good thing to take. And by the age of 45, there's so few women that have adequate progesterone. And, you can do a practical progesterone test because progesterone, you can get it over the counter. And I suggest that women in their 30s, many of them are losing the amount of progesterone that they need to balance the estrogen. And how do you know? Estrogen is stimulatory. Progesterone balances that overstimulation. It quiets it down. In fact, progesterone is the great quieter. So we want to have the optimal balance of estrogen and progesterone. If this is estrogen and this is progesterone, oh, here I go again, looking in this mirror.
I know, it's weird.
If you get too much estrogen and less progesterone, how you're going to get too much estrogen is you're not going to usually oversecrete estrogen unless you get a lot of stress going on, which you could. But the progesterone can decline earlier in your life than the estrogen declines and deeper. So you get an imbalance there. So I love women to get alert to the possibility that their progesterone's declined a little faster than their estrogen in their 30s. And how do you know? Estrogen overstimulates. If in your 20s you didn't really get massive breast tenderness or uterine cramps or PMS, no, it wasn't a big deal. Maybe you had a little bit. But if in your 30s you're starting to get increased breast tenderness and increased PMS and increased irritability, that means you didn't have enough progesterone. That's why I encourage women in their 30s to get progesterone, which you can over the counter. In fact, our team is even developing a progesterone in our organic oils for general usage. And you can start taking progesterone. Why can you take it over the counter? Because progesterone is so safe. And so many women are low. And with the over-the-counter stuff, you're not going to be able to give yourself an overdose. Well, how could you tell if you got an overdose? Progesterone is the great calmer. If you get too much calm, if you get like depressed or tired, let's say you put progesterone at sleep time, an ideal time to put it on because it can help you sleep. And you wake up in the morning and you're groggy, like you took a sleeping pill or something. That's too much progesterone. You took too much progesterone the night before. So it's a very safe thing to take. And you can't overdose yourself on over the counter. I mean, you never say never, but I don't think you could. Unless you're a woman who you're putting out the perfect amount of progesterone, then you could overdose yourself, but you don't see that very often. So, Dama, part number 1, you can take a lot of progesterone. It doesn't matter if you get your estrogen up to 70 or 100, between 70 and 100 or not. Getting your estrogen up is a matter of how deficient you are. When you say you're post, that means you don't have a period. You need to get your estrogen up. Now, I'm not a big fan of blood tests because, like, when did you take your last dose and when are you at the peak blood level? So that's a whole thing. The hormone testing that we're doing, I can accurately tell how high your estrogens are. One of the ways to tell if you have adequate estrogens is know what the symptoms of estrogen deficiency is. And Carolyn can guide you to download a Kindle or a PDF version of our book because it's right there on our ins and outs page. The Carolyn originated. Thank you, Carolyn. My God, what a gift you've given women. And now you gave us the gift of being able to communicate to these women. Yeah, 800 women.
You're the gift, I gotta say.
So what I do want to thank you for that, and our whole team wants to thank you for that, and for the great cooperating that you're doing to so we can co-create something that's just the best. And so one of the ways you can tell, Dama, is are you having symptoms of estrogen deficiency? Some women don't. And then that's one way, is alleviate those symptoms and then test with the proper hormone test. But my team is telling me, let me move a little faster here because we're getting a lot of questions. So
We are getting a lot of questions. Let me just interject really quickly again. This is our very first time doing this. So I promise you that we'll be able to answer these questions way better the next time. And I apologize that we can't get to every question. I haven't been able to get to some of my questions, but it's fine because we're learning and we're having fun.
Yeah.
Yeah.
These are great questions.
I do have a question for you, Dr. Rosensweet, that goes along with the progesterone thing that we always seem to get back to because for whatever weird reason, you know as well as I do, that many women do have problems with progesterone. They are, whatever. There is a question that is saying, why am I getting so much edema everywhere when I even take just a small amount of progesterone? And I don't know if you can answer that quickly or not, but this edema thing seems to come up a lot in regards to
it's a
progesterone.
paradox.
It is.
Here's the paradox. Progesterone, like every hormone, has a multitude of effects all over the body. And one of the effects of progesterone is it's a diuretic.
Yeah, how weird, right?
Get rid of fluid. So and whereas estrogen, excessive estrogen can cause a fluid retention, just on a simple ovarian hormone.
Interesting.
There's a lot of reasons you can get edema, and a lot of them don't have anything to do with the hormones.
Right.
So there comes a point where you want to have your healthcare provider take a look at that edema and look for other things. But let's just say that if it only comes on with the hormones, something's wrong. Because
someone's not getting it right.
Narrowed it down to, and here's how you narrow it down. As far as ovarian hormones go, you take only progesterone, but you don't take estrogen, you don't take testosterone, you take only progesterone, and you see if you get edema. And if you get edema, you stop the progesterone entirely and you see if the edema goes entirely away. And it could take you a while, days, a week, to stopping the progesterone, make the edema go away. And then you start up the progesterone again if it goes entirely away, and you see if the edema reaccumulates, because you want to narrow it down to, is it really progesterone? And if it turns out that it really is progesterone, I want to know what dosage you're taking. Are you taking too much dosage? Is it really in the optimal zone of progesterone? How are you taking the progesterone? Are you taking topical? It's hard to get edema with topical. It's hard to get your dosage up that high. Are you taking oral? What is the dosage? And how do you test out on a very proper hormone test? Okay, folks, there is what I consider to be proper hormone test. And get ready, get set. It's a 24-hour urine hormone test. And I know you can give me reasons for other testing, but I'm not going to buy them. So sorry to say, 24-hour urine hormone test is going to tell me where your progesterone is. Unless you're taking oral progesterone, anytime you take an oral steroid hormone, it's a tough thing to measure that steroid hormone because of a phenomenon called first pass of the liver, which I'm not going to go through today.
Right. No more liver. No more liver. That ties into a question that I was given in regards to testing other than blood. Is there a particular day of the cycle that you would want a woman to do that kind of testing? Does that matter?
Yes, it does. In a woman who's in menopause, it doesn't matter at all. But a woman who's still cycling, it matters greatly. And where you want that test to take place is the third week. day 20, 19, 20, or 21 on a 28-day cycle. And you could say, well, I'm not regularly cycling. Well, then testing isn't going to work well on you. Sorry to say. And how many women love to be tested once they're when they have regular cycles? Not too many. They're having regular cycles. They're not the ones that are having the challenge. It's the one with the irregular cycles. And I'm sorry to say that testing is going to help you if you have a regular cycle, which will happen in the perimenopause. Because I'm going to trace out what I'm going to call the normal estrogen curve and how it works. This is day 1, the first day of menstruation. I got to do this backwards. Oh my God, I hope I can do this. This is day 1, and then the estrogen rises gradually, and by day 12, it's at its peak, and then it falls, the estrogen, and then it rises again, not as high, and this is in the 3rd week, right there. That's day 21. And that's the day we want to test you, 19,
Magic
20,
day.
21. And then it falls and you menstruate. That's estrogen. Here's progesterone. Very low unless you ovulate. If you ovulate, you get this burst of progesterone. Burst off the charts, much higher than the estrogen. And then it gradually declines and you, sorry, going backwards. You menstruate. So it's this time over here when the estrogen is at its secondary peak. It's not as high as its mid-cycle peak. And the progesterone is going to be at its super peak. And you get to assess estrogen and progesterone. And otherwise, you don't know where the heck you are in a cycle. So you can't interpret the test results. Now let me tell you about the perimenopause. And I'd like to add that hormone testing doesn't matter that much in the perimenopause. Because here's what's happening in the perimenopause. Let me see if I can do this. Oops. Your hormones are lower. The estrogens are lower. Well, the pituitary gland doesn't like that. The brain and the hypothalamus and the pituitary gland goes, oh my God, our estrogens are low. Let's try and stimulate that ovary to produce estrogen so it doesn't go out. It doesn't go to sleep. So you get this burst of a follicle stimulating hormone, and you get a burst of estrogen, but the ovary doesn't have the power it used to. So then you get a trough, you get something lower. And over time, what happens is you get these peaks and troughs, and you don't know what you're going to do. So I had to give you an example. I had a woman in the perimenopause. She was having hot flashes almost every day. I knew she was low on estrogens. I tested her by a very sophisticated hormone test, 24-hour urine hormone test. And her estrogens came in high. And I said, but I still want to treat you with estrogens because you're getting these hot flashes. I know you're low. And she looked at me like I was nuts. I had to do a hormone test, and the report shows her estrogens are high, and I want to give her estrogens.
Right.
So you don't test in the perimenopause because of this crazy up and down, higher peaks than the woman ever had in her life, or lower. So you don't get good information. And the good news is you don't have to, because you get plenty of information from listening to a woman's story. Sorry, I'm not going to go further, and I want to answer question number 4 here. Have you seen women whose estrogen does not increase while on BHRT creams and or oral? Never. Now, it depends what kind of creams or gels, or, we are great fans of the organic oils. Certified organic oils is the base. We always see an increase. And here's the thing. The older a woman is, her skin isn't as healthy and as absorbent as it was when she was in her 30s or 20s or 40s. So sometimes the absorption is not as robust, but it doesn't matter. We just increase the milligrams per milliliter. We just increase the strength, and it's no problem. But I have yet to find a woman that does not absorb estrogen. And we're, for the last 12 years, the base that we use is the certified organic oils that come in these lovely little bottles. You shake the bottle, you turn it upside down, out comes a drop. And yeah, never seen it. Oral estrogen, no, don't do it. Why? Because we first learned with the birth control pills. that as powerful and as effective as they were in preventing pregnancy, every so often a woman got thrombophlebitis, clot in her leg vein. And every so often, uncommonly, but it happened, that clot broke loose and went to the lungs. And that was a big problem
Yeah.
called pulmonary embolus, because oral estrogens stimulate the clotting, the coagulation process, make you more coagulable. So if you have a vulnerability there, you can get a clot. So I say don't take oral estrogens. You don't need to take them orally. They also stimulate the inflammatory response. Nobody needs more inflammation these days, or hardly nobody. And you got to have to take a lot more dose orally because of something called first pass through the liver, which I'm not going to explain, but I do explain in our book, Happy Healthy Hormones. So why I just say you got to get the right base. You'll absorb it because I've never seen someone who didn't absorb estrogen. Then the rest of this question is, are there factors that inhibit the body's ability to convert the estrogen supplements to an increase in estrogen? Well, when you're applying it to the skin or to the mucous membranes, let's say biased, because that's the best one to apply, read the book, you'll see why we recommend the combination of estradiol plus estradiol 4 times as much or 3 times as much estradiol. It goes right in the bloodstream. It does its beautiful estrogen effect. And then, so it doesn't have to convert anything, because when you're doing bioidentical hormones, you're applying the same hormone that your ovary used to produce. In this case, estriol and estradiol. And they go circulate through the whole bloodstream, and then they get to the liver. And any conversion that takes place is primarily, you're talking about what happens when the hormone gets to the liver finally. And I talked about conversion at the beginning of this. I talked about metabolizing of estrogen in the beginning. So yeah, something's not right about what you're applying or how much you're applying the strength. I've seen it common for physicians or healthcare providers to supply these, to prescribe these super low dosages. So if you can type in your dosage, I'll give you a clue. But I don't understand why they do this, but they do. So it's a dosage phenomena, and it's a carrier phenomena. Get to the organic oils. Question number 5. Is that all right, Carolyn, if I go to question number 5?
Yeah, I just have one question I want to ask you, if I can, if you'll save me some time to do that.
Yes, let me answer question number 5.
Yeah, no problem.
And then we'll go right to your question.
Thank you.
I'm dealing with perimenopause. Why do I have anxiety mostly in the mornings when
Oh my God, what a great question.
Yeah. When I'm just getting up? And is hunger, anxiety such a thing?
Yee.
Well, as the ovarian hormones decline, as they are in the perimenopause, your estrogen is lower than it's been since you were 20. Your progesterone is very low or nil. If you didn't ovulate, that's one of the things that happens in the perimenopause. It's very easy to get anxiety. And one of the reasons is your body doesn't like low hormones. And your brain and your hypothalamus is very capable of reading when your estrogen levels have dropped and your progesterone levels have dropped. It's stressful, and it can trigger the biology of the stress response, and an accoutrement of the hormones that are excreted to fight or flee, which is the biology of the stress response, is adrenaline. And that can get anyone anxious. Anyone who took a diet pill, which is an artificial adrenaline, many of you got pretty anxious, pretty alert, and then the hormones themselves, these are some of the most powerful biochemicals you have in your body. The ovarian hormones. Thyroid's powerful, the adrenal hormones are powerful. But the adrenal hormones, they might be a little declined, but they didn't drop. The bottom usually didn't drop out for most people. But the ovarian hormones in the perimenopause, the bottom is dropping out. And they've got very low levels. And these are the feel-good things. when you don't have enough progesterone, there's women who feel like they're going crazy. Or talk about, well, remember I said that progesterone is the great calmer. What happens when you don't have the great calmer circulating around your body? Some of you have been pregnant. You might have remembered that you were almost in a meditative state sometimes during the day because the progesterone levels were so super high. When that progesterone stops getting secreted, as it does in the perimenopause, bye-bye, you get anti-calm, otherwise known as anxiety. And there's women who are leading good lives and they're getting anxious or they're getting depressed. So how I teach physicians and other healthcare providers, nurse practitioners, when you have a woman in the perimenopause that's got all kinds of emotional symptoms, treat the menopause first and get it right and see if there's any left, any of these symptoms remaining. Hunger anxiety is an interesting thing too, because when you're usually hungry when your blood glucose is dropped, and that can also cause for an output of adrenaline, and that can get you anxious too. Carolyn,
Well, I want to piggyback on that because my history. I went 17 years without hormones. I was a big anxious mess. And I really did think I was going crazy. I thought I was going to probably be put away because I couldn't walk out of my front door. And you very kindly explained to me that when we, this is kind of my version of it, but when we don't have any estrogen, then the brain sends out a signal for estrogen to be sent out, but we're very low or we don't have any. So then we recruit in another hormone in its place, that being pure adrenaline, right? Am I on the right track?
Well, yeah, let me pick it up there. And I'm just getting a notification for the team that
Yeah.
we've got less than 5 minutes.
Okay.
So, yes, you are. Women who've had hysterectomies or women who are in menopause, they're not producing hardly any estrogen at all. And same for progesterone. And sooner or later, it's going to be low testosterone. If you get stressed, you're going to have to rely heavier on the adrenal hormones, because in a young, healthy woman, estrogens are also recruited. Testosterone is also recruited for the biology of the stress response. So absent the contribution of estrogen and testosterone from the ovaries, you've got to ramp up your other favorite stress hormones, fight or flight, adrenaline, and cortisol. So that can get you a little weird. Here's what I'd like you to do, all of you. I mean, what a dynamic, active day. And
I know, huh?
I love doing this. And here's what we suggest that you do. You write your questions down, and we'll try and get back to them later. Or you go on to Facebook, Ins and Outs, write your questions there. You can see I'm getting pretty active there on Facebook. And then we're going to have a Facebook Live this time every week. And Carolyn and I will be here to answer as many questions as we can. And if we get overwhelmed with more questions than we can handle, perhaps we'll do a second one. I don't know. But
Can we
right
still
now,
do
you
our,
write the questions down.
will we be able to do our interviews still? Our regular one?
Yes, that's another way to do that. We could do an interview a week.
Cool.
So at any rate, I'm going to have to sign off for today. And yes, thank you, Carolyn, for initially inviting me to be interviewed, and then all those interviews we did, and look where we've progressed. We're now sharing this ins and outs of menopause. And to all you women out there, this is something I really enjoy, is answering your questions, because if I can answer your question, there's going to be an actual person that could benefit. Bottom line, link up with a healthcare provider who really knows what they're doing and do it. Become a member of the menopause method. This is the best that I can see on the planet Earth. So Carolyn, once again, I thank you. And to all of you out there,